Hello everybody, welcome to my YouTube channel, Homoeopathy Super Sessions by Dr. Jagos. Today I'll be doing J.H. Allen, Predisposition. It is a continuation of the chapter on idiosyncrasy. Now, predisposition, it is a condition which is closely related to idiosyncrasy. They are so closely related that we find it difficult to separate it. So, they are both of them, predisposition and idiosyncrasy, they both are closely related or interlinked to each other. It becomes very difficult to separate it. Thus, predisposition means to have a weakness in a particular direction beforehand. So, it is a weakness, predisposition, nothing but a weakness, and that weakness can be seen beforehand. In other words, it means to have a weakness that predisposes us to certain diseases or certain conditions of life. So that means the weakness is there to certain diseases or to certain environmental influences or the conditions which will modify our life. Thus, idiosyncrasy and predisposition has gained importance with the word temperament. Here we see that a particular temperament is predisposed to a certain form of disease. So, different temperaments are predisposed to a certain diseases. For example, the bilious temperament of nux vomica patient, we can tell to a certain extent the disease which he is predisposed to. This may be in a direct manner, hepatic or a GI tract disease. Indirectly, it can result from abuse or excessive peculiar to his mental makeup and his moral weakness. So, directly, there will be a diseases of the hepatic or of the GI tract disease, or indirectly, as a result of abuse or excessive peculiarity on his mental makeup. It is really difficult to say where idiosyncrasy ends and predisposition begins. So again, Dr. J.H. Allen says that it will be difficult to say when idiosyncrasy ends and the predisposition will begin. Just to remind you, Dr. J.H. Allen says that idiosyncrasy is nothing but the peculiar behavior of the patient on the both mental level as well as on the physical level, whereas predisposition will be a way in which you can forecast that something is going to happen. So therefore, he says it becomes difficult to say where idiosyncrasy ends and predisposition begins. We cannot separate them and it becomes a complement to each other. Thus, removal of one will cause the disappearance of the other. So if you remove one, automatically the other one will disappear. For example, a patient may be predisposed to orbital neuralgia who has an intense craving for salt, the removal of which may take away the predisposition to the orbital pain and desire for salt. The same may be said for gastritis. So this can be achieved by giving a high potency of natrum mu. Thus, those patients who are very sensitively predisposed to every disease, we see that the tubercular type or the miasm of Sora and syphilis are firmly implanted on the organism. So, those people who are predisposed or those who have a strong predisposition to a certain type of disease, it is nothing but the miasmatic background which is responsible for the predisposition. Just like in the idiosyncrasy also, at the background, we have the miasm, that is the tubercular miasm. What Dr. J.H. Allen says, besides the tubercular miasm, it can be any other miasm also. So same thing also goes for the predisposition. He says that we see at the back of predisposition, the miasm is there, especially of the tubercular type, or the miasm of Sora and syphilis. As you all know, tubercular miasm is a combination of the Sora and the syphilis miasm, which is firmly implanted on the organism. However, Sora alone seldom predisposes to any extreme or excessive states. So he says that if only soric miasm is there, then it may not predispose to such excessive states. But the combination of Sora and syphilis, which is the parent of the tubercular diathesis, gives us all kinds of excessive states. But if you want these excessive states to come or to manifest themselves, the tubercular diathesis should be present, which is a combination of the SORA and syphilis. Only SORA will not predispose to the excessive states or to the disease condition. So these parents may be, so these people or the persons who have a combination of the SORA and syphilis or the tubercular diathesis, the parents may be either too tall or too short, too dull or too bright. They develop too slowly or too fast. They are mentally too dull or bright. The teeth become slowly or the teeth come on slowly or at long intervals. So, as you all know, in the tubercular miasm, there are many oscillations, there are many swings, there are many fluctuations. It's just like a pendulum going from one side to the other side. So, therefore, you may get a too tall person, or a too short person, a too dull person, or a too bright person. So, as you can see, these oscillations or these fluctuations or this changeability is seen in the tubercular diathesis or the tubercular miasm. Furthermore, he says that you also get spasms or convulsions with febrile states or gastric disturbances. So the spasms or convulsions may come on with febrile states or when fever is there, or it may be also associated with some sort of gastric disturbances. Thus, the children are predisposed to all the sequences to the presence of the two elements, syphilis and SORA. So, why does this occur? This occurs because the children or the patients, they are predisposed because of the elements of the miasm, that is the syphilitic and the soric miasm. It is one of the most destructive of all the miasmatic force. It is one of the most destructive of all the miasmatic bonds with the life force. So the tubercular miasm, it contains the syphilitic element. Hence, initially you may get a reversible change, but as the disease progresses from the SORA to the syphilitic state or to the syphilitic miasmatic state, it becomes irreversible. Therefore, it becomes most destructive. Occasionally, we see patients who are not predisposed to natural disease states, but who are extremely sensitive and predisposed to arterial disease, such as the plant poison of dust family. So, he's giving you another example, saying that we see patients who are not predisposed to the natural diseases, but they are predisposed to artificial disease like that of the Rustox family. Many patients have presented with Rustox poisoning. So, if the patient goes in the forest where the Rustox leaves grow, then probably if they are predisposed, they will present themselves with the Rustox poisoning. So how will they present themselves? They have their hands and face covered with erysipelas inflammation, so much so that it might be called an idiosyncrasy. So again, it reminds you that idiosyncrasy and predisposition, they are mostly complement to each other. You cannot separate it. You cannot come to know where idiosyncrasy ends and predisposition starts. So therefore, he says that those patients who are exposed to the Rustox plants and they get poisoned with it, they have their hands and face covered with this erysipelas inflammation. And so you can say so much so, you can call it as idiosyncrasy. Thus, we have idiosyncrasy behind the predisposition, which manifests the action of the poison. So behind the predisposition, what do we have? We have this idiosyncrasy. Therefore, it says idiosyncrasy and predisposition both are complement to each other. Therefore, idiosyncrasy, no predisposition patients are healthy human beings. So he tells you that the patients who are either idiosyncratic or who have a certain predisposition, they are never to be in a healthy state. They have some deep-seated soric or some other miasmatic taint from which this condition arises. So again, same thing. This condition will arise because of some deep-seated miasm. For example, the soric miasm. They exist in the dormant or the latent state. The same thing is told for idiosyncrasy also. Example of an apparently healthy child. So Dr. J.H. Allen has given example of an apparently healthy child. The child says 9 years of age is apparently in a good state of health, but the child is predisposed to every acute disease of the contagious type. So a child of 9 years of age is there, but he or she has a predisposition to every acute disease of contagious type. So as the patient grows, he'll be predisposed to all the contagious diseases of the acute type. The child has gone through all the diseases of the children's type. So what happens? The child will manifest the different diseases which come up during the childhood days. If properly treated with a single homeopathic remedy, the child will be free from any sequelae and the miasm will be eradicated. So Dr. J.H. Allen says that if such a child who is predisposed to every acute disease of a contagious type and the child has passed through all the diseases of the children type, then if a proper homeopathic single remedy is given, that is a similimum is given, the child will be free from any sequelae of the disease and the miasm which is responsible for this predisposition will be totally eradicated or abolished. If, however, improper treated, the miasm will stagnate and remain permanently or in time will destroy the life. But however, if you do not treat it properly or only if you take the case superficially and you take a similar drug and not the similimum, then what will happen? The cause behind the disease, that is the miasm, that will stagnate. It will not go, our remedy will not penetrate deeper into the organism and will not affect the miasm which is responsible for it. Therefore, the miasm will stagnate and will remain permanently or in time will destroy life. And naturally, if our remedy doesn't touch the miasm and the miasm stagnates, then naturally time will come where the life will be destroyed. Thus, the practitioner should be knowledgeable to detect the latent miasms and select a deep-acting and miasmatic remedy that will remove the idiosyncrasy and the predisposition. So, Dr. J.H. Allen says that the practitioner should be knowledgeable for what? To detect the latent miasm. So the practitioner should know that this predisposition is because of some latent miasm. This latent miasm has to be removed by choosing a deep-acting miasmatic remedy. This deep-acting miasmatic remedy, that is the similimum, will also remove the idiosyncrasy and predisposition. Not only that, it will help to cut down the history of illness that the child has been prone to. So if you take a correct remedy, which is a deep-acting miasmatic remedy, it will definitely cut down the history of the illness to which the child is prone to. As a rule, many practitioners just treat superficially the disease. So Dr. J.H. Allen says that most of the practitioners, they do not bother to take a deep case or to take the case in depth to find out what are the miasmatic expressions and to give a deep-acting anti-miasmatic remedy. What do? They just take the case superficially, whatever presenting symptoms are there, they prescribe on that, and that remedy doesn't touch the miasm. They do not go into the depth with the soil of the disease as its origin. That means what? The miasm. The soil of the disease meaning what? The predisposition of the patient. That is the family history in which you have to go in depth and find out what is the miasm behind the predisposition. That is to say the miasms. Thus, the practitioner has to prepare the soil in such a way to bring about health and strength of the individual. So what the practitioner has to do? He has to prepare the soil. Soil meaning what? The miasm. That means what? He has to modify the miasm in such a way that he'll be able to bring health and strength to the individual. Modify meaning what? To eradicate the miasm by the means of a deep-acting constitutional anti-miasmatic remedy. Many a times we give the correct anti-miasmatic remedy according to the law of similar, but make mistake in potency selection. So the next hurdle, Dr. J.H. Allen tells us that sometimes even if our correct anti-miasmatic remedy is there, which we are taking according to the law of similars, but at times we do not get the result. Why? Because there is some mistake in the potency selection. We may give a low potency, which is capable of eradicating the superficial or acute symptoms. So if we give a low potency, then this low potency will only be capable of eradicating the symptoms which are superficial or the acute symptoms. The deeper pre-SMI symptoms are not touched. So the deeper symptoms, which are totally because of the miasms, they are not touched. Thus, the predisposition and idiosyncrasy are still there to threaten the patient with new disorders. So, naturally, you will not touch the predisposition nor the idiosyncrasy, and this will threaten the patient to be more prone to new disorders. So, Dr. J.H. Allen says that when you take the deep-acting constitutional medicine, generally speaking, you have to give it in a high potency. If you give it in a low potency, only the superficial symptoms will be eradicated, or the acute symptoms will be eradicated, and the deeper pre-existing miasm symptoms are not touched. The highest potency should have been removed or taken away all the phenomena that disturbs the life. So he again tells you that if you use the highest potency, then it will remove all the phenomena that disturbs the life. That means what? The miasm will be eradicated, and the miasm is responsible for the phenomena to disturb the life. Thus, once again, to recap, idiosyncrasy or predisposition is a habit-forming condition of the life force, which has passed through generations of miasmatic action and destruction. So, idiosyncrasy and predisposition are inborn, and they are passed through generations of miasmatic action and destruction. So, as from one generation to another generation to another generation, the disease is passed. Similarly, the miasms also are passed in different generations. Example of malarial fever, wherein the potentized remedy cures the chill, never to return. So in case of malarial fever is there, the chills are taken care of by the use of the potentized remedy. And once the correct potentized medicine is given, the chill will never return. Although the patient stays in the same locality, under the same massive influence and the climatic conditions. So he says that though the patient will stay still in the same locality, and he'll be also under the same miasmatic influence and the climatic conditions, but the chill will never return of the malarial fever, because a correct potentized homeopathic medicine which touches the miasm is given in the high potency. This is because the anti-miasmatic remedy modified or removed the effects of the chronic miasm. So whatever anti-miasmatic remedy you are giving in the high potency, it has modified, it has annihilated, or it has destroyed the effects of the chronic miasm. The phase of the physiological perversions may be carried into the moral sphere. So whatever phase is there of the physiological perversions or the physiological expressions, they are carried onto the moral sphere. Manifested by desire to steal, the use of alcohol or tobacco or the stimulants, which may be traced back to miasmatic taints such as psychosis, syphilis, or both. So, whenever the physiological perversions are distorted, it goes back into the moral sphere, wherein patient has a desire to steal or to have some intoxicating drugs or elements like tobacco, smoking, alcohol, use of marijuana and other drugs, and or other stimulants, but these are all traced to the miasmatic taint of the psychotic or syphilitic miasm, or both psychotic and syphilitic. They may be born with just the right kind of toxic elements in their system that will prompt the mind and propel everything in the direction. So Dr. J.H. Allen says that it could be a possibility that they are born with just the right kind of toxic elements in their system, so that it will be ejected and into the mind, and it will flow in the particular direction. So the right kind of toxic elements in their system, that is the miasm at the background, either the psychotic miasm or the syphilitic miasm or the both miasms, that will help propagate the disease or the longings or the desire for alcoholic stimulants, drugs, etc. We see this type of condition fall upon one child or member of a family. The long history of hereditary perversions is the result. So we see such type of condition, either one family member or one child will be suffering, or a member of a family and a long history of hereditary perversions is the result. Or you may get also a member of the family suffering or one child suffering because of the long history of hereditary perversion. That is nothing but the long history of the hereditary miasms, which are expressing through the different perversions on the mental and the physical level. So that's all what he wants to say about predisposition. So I hope it's a bit clear to you regarding predisposition, idiosyncrasy, and predisposition. Both are complement. It is very difficult to separate it. And I'm sure you must have had a proper understanding now after listening to this video. Thank you very much.